Welcome to our second bite-sized video, where we aim to provide you with a brief overview of Part 3 of the Health and Care Staff in Scotland Act 2019. This video will be focusing on arranging staff and the responsibility of providers, which is applicable to the ELC sector. The Safe Staffing Programme was commissioned by the Scottish Government to support care services to prepare for this new legislation, the Health and Care Staff in Scotland Act 2019. This is the first legislation in the UK to set out requirements for both the health and care service. When enacted in April 2024, it will affect legislation that guides the requirements of services you currently provide. The Act links together supporting documents and guidance already in use and have been now put into legislation. The current legislation that covers staffing is Regulation 15 of the Scottish Statutory Instruments. It is a small paragraph in the instruments which details how providers must have regards to the size and nature of the care service when arranging their staffing, and ensuring that at all times suitably qualified persons working in the service. The asks of the current regulations are all still present in the new Act. They just go into more detail, and there's a focus on the recognition that we all know and appreciate that high quality staff provide high quality service. The current expectation is when the Health and Care Staff in Scotland Act comes into place in April 2024, this regulation from the current instruments will be revoked. Part 3 of the Act outlines the duty on care services to ensure appropriate staffing. You still need to fully consider how many staff you need to provide your service. The minimum ratios provided by the Care Inspectorate will not be changing at this time for any service in ELC, and the new legislation does not impose specific staffing levels. Services need to consider how they arrange their staffing around children's needs and not set ratios. Part 3 of the Act details how you should determine what constitutes appropriate staffing levels by considering the nature of the care service and the kind of service you provide. The size of the care service, the aims and objectives you're working towards, the number of children experiencing care, and the needs of these children should all factor when determining what considers your staffing requirements. This slide demonstrates the similarities between the current Regulation 15 and the new legislation, with wording from Regulation 15 on the left-hand side of the table and the wording from the new Act on the right-hand side. The only addition can be found at the bottom, the well-being of staff. In Part 3, the focus on staff well-being relates to how it will affect the main purposes of providing safe and high-quality service and ensuring the best outcomes for the service users. A few examples may be, do staff feel safe to raise issues without fear of retribution? And is there a culture of service improvement rather than blaming individuals? Considering staff's views about the number of staff they need to best support the children they are currently caring for in their area, and their ability to cope with a combination of children's individual needs. Services should consider how they support staff to feel confident in their roles that they are to carry out. Are they included in reviewing policies, procedures, and risk assessments in order to achieve those improved outcomes for the children? It is also Part 3 of the Act that details the training of staff and the responsibility on providers to ensure the staff are appropriately trained to carry out the duties. To fulfill current legislation, we already ask providers during inspection about induction plans, schedule supervisions and appraisal systems, in order for providers to assess, monitor and plan appropriate training needs for individual staff. This links to the new legislation, which is about staff receiving appropriate training for the work they are to perform and being assisted to ensure their professional learning is current. A knowledge and skills framework has been developed by the Healthcare Staffing Programme within the Healthcare Improvement Scotland and NHS Education Scotland. The aim of this framework is to support all staff within the health and care sector, to provide a consistent and inclusive approach to learning and development, and to support individuals and organisations in their understanding of workload and workforce planning and the application of this legislation. The framework is broken into 4 domains, and within each domain there are 4 skill levels. The modules for the first two skill levels, Informed and Skilled, are currently available on the Tourist site, which is an NHS Education for Scotland learning and development platform. Although predominantly an NHS resource, everyone within the social care sector can set up a free account and access the training. The enhanced and expert levels are still being developed to ensure the modules can offer an effective learning experience for all sectors. The further development is underway, and the SSSC will keep the sector up to date with the expectations of the use of this learning resource. Thank you for watching this bite-sized guidance of Part 3 of the Health and Care Staff in Scotland Act 2019. I hope that it was helpful to prepare you for enactment in terms of becoming aware of this new legislation. Within the Hub, you can access additional support. There is a bite-sized guidance which talks through Part 1 of the Act, and you can find supporting guidance documents about the Act. Please join our mailing list to ensure that you are kept up to date with any upcoming events and any relevant information which may affect you in the sector. Thank you.